All right, I'm Ray. I'm from Professor Lukowski's class, Section 9. We're doing IV mini bag drug administration. So we're gonna be so we start out with standard protocols. Look at the MOR for the meds, the dose, the route, the frequency, any pertinent labs or allergies. The patient doesn't have any allergies. But what we'll be giving today is 1 gram of Rocephin. It's available 500 milligrams per milliliter, so we'll be giving 2 milliliters. It's indicated for skin infections, urinary tract infections, and respiratory infections. And we're giving it today for pneumonia. So I've got my calculation here for it will be 17 drops a minute. And so I would first draw up the 2 milliliters of Rocephin. I'd clean this, or I'd wash my hands. I'd clean this with alcohol swab. Alright. It's 2 milliliters. And then I need to clean this with an alcohol swab. And I would just like that, check the 2 milliliters, and this would go in a sharps container. And so then I need to set up tubing. Right. So hang that up. And label what drugs in there, the amount of the drug, the date, the time, the patient, and my initials. And I would also label the tubing for the time. And then I would prime the tubing. All right. And then I would go into the patient's room with tubing and my pre-filled saline syringe. I'd wash my hands. I'd put on gloves. I'd check the patient's armband and ask them if they have any allergies and to verify their name and date of birth. And then I would clean the port with the alcohol swab, unclamp, attach this, draw back for blood flow, it's there. Then doing the start and stop method, I'd push 3 milliliters and ask them if there's any pain, look for any swelling or anything like that. And so the IV site is patent. All right. And then I would clean this with an alcohol swab, and the end of the tubing with alcohol swab. And I would attach this and slowly unclamp so that it starts dripping, and there it goes. And I would check to make sure that it's going at 17 drops per minute, and I would wait a minute before leaving the room to make sure the patient isn't having any allergic reaction to the medication. If they did have a PICC line, I would have flushed that with heparin, but and I'd come back every 10 minutes to look for any sign that they're having issues with an allergic reaction or something like that. And after 30 minutes later, after this is done, it would take the IV off, clean that with an alcohol syringe, attach my saline. Doing the start-stop method, I'd push 3 milliliters. After pulling back, check for blood flow. And I would then unattach that, clamp that back, and then I would state my documentation, the time. I would document the time, the drug, the dose, the route, the site, the patient's reaction, and how much fluid I gave. And that's it.